In today's video we're diving into a topic that's not just critical, it's potentially life-saving, recognizing the early signs of a stroke. Did you know that strokes are a leading cause of death and disability in the United States? Each year, nearly 800,000 Americans suffer a stroke, and almost 140,000 of those cases are fatal. That's roughly one stroke every 40 seconds and one death every 4 minutes. But here's the good news. Up to 80% of strokes are preventable. A stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. The key is early detection. Today, we'll be highlighting 9 crucial symptoms that can appear up to a month before a stroke happens. We'll also explain the differences between ischemic and hemorrhagic strokes, and we'll touch on transient ischemic attacks TIAs, or mini-strokes, which are major warning signs you shouldn't ignore. Understanding these symptoms could mean the difference between life and death for you or a loved one. So stick around, because what you learn today could help you act quickly and save a life. Now, let's talk about the types of strokes. There are 2 main types, ischemic and hemorrhagic. Ischemic strokes are the most common, accounting for about 87% of all strokes. They occur when a blood clot blocks or narrows an artery leading to the brain, cutting off vital blood flow and oxygen. Hemorrhagic strokes, on the other hand, happen when a blood vessel in the brain bursts, causing bleeding in or around the brain. This type is less common but more deadly. Have you heard of TIAs? They stand for transient ischemic attacks, often called mini-strokes. TIAs are temporary blockages that don't cause permanent damage but are serious warning signs of future strokes. They produce stroke-like symptoms but last only a few minutes to a few hours. Don't brush off a TIA, it's a critical signal to seek medical attention immediately. 1. Sudden onset of severe headaches. One of the most common early signs of an impending stroke is the sudden onset of severe headaches. These headaches can be different from typical headaches or migraines, as they often appear without any apparent cause and can be more intense. If you or someone you know experiences a sudden, severe headache that doesn't seem to have a clear reason, it's important to take it seriously. These headaches may be accompanied by nausea or vomiting, and they can indicate a significant change in the brain's blood flow. Remember, while headaches can result from many different conditions, a sudden, severe headache that's out of the ordinary should never be ignored. 2. Sudden onset of dizziness or loss of balance. Another early warning sign of a stroke is sudden dizziness or a loss of balance. This isn't just your average lightheadedness from standing up too quickly, it can feel more like the room is spinning or that you're about to pass out. This type of dizziness can be severe and may come on suddenly, even when you're sitting or lying down. Alongside dizziness, you might also experience trouble walking or coordination issues. If you experience sudden, unexplained dizziness or balance issues, especially if it's paired with other symptoms like numbness or weakness, you should seek medical attention immediately. 3. Numbness or weakness, especially on one side. Numbness or weakness, particularly on one side of the body, is a classic stroke symptom. This can affect the face, arm, or leg, and it often starts suddenly. For example, you might notice that your arm or leg feels heavy and difficult to move, or that one side of your face is drooping. This occurs because the brain's ability to send signals to these parts of the body is compromised. A great way to remember this is with the FAST acronym: face drooping, arm weakness, speech difficulties, and time to call emergency services. Even if the symptoms are mild and go away quickly, they could be a sign of a transient ischemic attack, TIA, which is a warning stroke. 4. Sudden changes in vision. The 4th symptom to be aware of is sudden changes in vision. This can include blurred vision, double vision, or even a temporary loss of vision in one or both eyes. These visual disturbances can happen suddenly and may last for a few minutes or longer. They're a sign that the brain is not getting enough oxygen, which can precede a stroke. It's important to note that these visual symptoms can be easily overlooked or attributed to less serious issues, but they should never be ignored if they occur suddenly and without a clear cause. 5. Sudden confusion or trouble understanding. Sudden confusion or trouble understanding others can be an early sign of a stroke. This symptom may manifest as difficulty comprehending spoken or written language, trouble following conversations, or an inability to focus. You might notice that simple tasks become challenging and things that were once clear now seem confusing. If you or someone you know experiences sudden, unexplained confusion or difficulty understanding, it's important to take this seriously and seek medical help. 6. Difficulty speaking. Another warning sign is difficulty speaking. This can include slurred speech, trouble finding the right words, or speaking in sentences that don't make sense. It can happen suddenly and might be noticeable to others before you realize it yourself. Speech difficulties often go hand in hand with other stroke symptoms, but they can also occur on their own. If you notice sudden changes in your ability to speak or understand speech, it's a sign that something could be wrong with the brain's communication pathways. Seek medical attention immediately. 7. Sudden nausea or vomiting. Sudden nausea or vomiting, especially when combined with other symptoms like dizziness or headaches, can also be an early indicator of a stroke. This symptom might be dismissed as a stomach bug or food poisoning, but it's crucial to consider the context and whether other symptoms are present. 8. Sudden fatigue or weakness. Sudden, extreme fatigue or weakness that doesn't have an obvious cause can be another early warning sign of a stroke. This isn't just feeling tired after a long day, it's a profound sense of exhaustion that makes it difficult to complete even simple tasks. You might feel weak all over or notice that one side of your body feels significantly weaker. Pay attention to sudden changes in energy levels, especially if they occur alongside other symptoms like numbness or dizziness. 9. Sudden mood changes or personality shifts. Sudden mood changes or shifts in personality can also be early signs of a stroke. This might include sudden irritability, anxiety, or even depression. These changes can occur without any apparent reason and can be quite noticeable to those around you. The brain is responsible for regulating mood, so disruptions in its blood flow can lead to unexpected emotional changes. If you or someone you know experiences sudden, unexplained changes in mood or behavior, it's essential to consider it as a possible warning sign of a stroke and seek medical advice.